Myanmar, or officially known as Republic of the Union of Myanmar, is bordered on the northwest by Bangladesh and India, on the northeast by China, on the east and southeast by Laos and Thailand, and on the south and southwest by the Andaman Sea and the Bay of Bengal. It is a country abundant in jet and diamonds, as well as oil, natural gas, and other minerals. Myanmar is also well equipped for renewable energy, with the largest solar power potential among the Great Mekong sub-region's country. COVID-19 pandemic hits the entire world badly in many aspects, especially economy. COVID-19 or coronavirus disease 2019 is a contagious disease caused by severe acute respiratory syndrome, coronavirus 2, SARS-CoV-2. Physical or social separation, quarantining, ventilation of indoor spaces, covering cough and sneeze, hand washing, and keeping unclean hands away from the face are all examples of preventive methods. In public places, the use of face masks or covering has been advocated to reduce the risk of transmission. COVID-19 cases in Myanmar nowadays recorded 145,603 cases, where 132,928 reported that they already recovered from the disease. However, there are 3,244 death cases reported in the country, which signs that proper measures required to be implemented by any responsible parties, including the public.
The first issue is unprepared health system. Myanmar's health system is already affected by common issues to developing nations, such as a scarcity of competent healthcare personnel and underfunded health facilities. Myanmar's healthcare system frequently ranks worst in the world, and it is one of 57 nations with serious healthcare worker shortage. Other than that, they also had shortage of human resources in terms of laboratory workers, logistics, and data management. There is an inadequate testing kit for COVID-19, and they also rely on test kit on the other nation. COVID-19 had a greater impact on healthcare employees than other professions, since they are directly accountable for the well-being of patients. Issues such as weariness from a severe workload, inadequacy or lack of personal protective equipment, and the fear of getting and spreading an illness face healthcare workers. The second issue is income and food shortage. The pandemic has effects on Myanmar's economy that cause economic and food shortage. The pandemic's significant drop in contributions is likely to affect household income. Day by day, workers have been laid off. Besides that, most of women workers as a health worker at hospitals and also at clothing industry. Unfortunately, their income had been impacted by manufacturing closure since they want to decrease the case. There are some households that are missing their supply of food, and some were gone into debt just to buy their food. The third issue is domestic unrest. The government's conflict with ethnic armed organization EAO makes it difficult to plan an effective pandemic response. The violence has resulted in population relocation as well as interruption of transportation routes and supply chains. The committee that coordinates and collaborates with EAO to regulate and treat COVID-19 established a unilateral ceasefire with EAO in May, although the conflict in Rakhine and Chin between the military and the Arakan army continues. Even though the government has provided personal protective equipment to internally displaced individuals at campsites, yet overcrowding and poor living conditions in IDP camps increase the danger of transmission.
The first implication is Myanmar suffer food and income shortage. The pandemic impact towards Myanmar's economy hit really hard, especially in terms of food and income of people. The pandemic's sharp drop in income is likely to decrease household income. Majority of Myanmar's working population is unregistered. Thousands of day laborers have been laid off. According to Shibani, more than 80% of households are skipping meals, and that others are taking on new debt to pay for food. Under the COVID-19 Economic Relief Plan (CERP), the government implemented several measures, including unemployment benefits for registered workers, designed to target income support, and a one-time food supplies to household members without even a regular income. All of these form a 400 billion kyat, approximately $309 million program to support items of clothing, tourist industry, and small and medium-sized enterprises through soft loans. Farm workers, roadside vendors, and the microfinance industry are also given soft loans. Myanmar also closed the border around them, which affects the economy to catastrophe as the imports and exports of Myanmar cannot be run smoothly. The second implication, Myanmar facing a risk in increasing the spread of COVID-19. This is because due to the military coup, where the military has taken control and proclaimed a year-long national emergency, the military forces would have support the opposition, which had demanded a rerun of the election due to widespread fraud. Numerous healthcare professionals as well as other public servants had also stopped working as part of a civil disobedience movement or CDM to boycott the military coup in such a peaceable and non-violent manner. The CDM has distributed across the health workforce, leading in the closure of public hospitals and the emergence of a healthcare system through crisis. Moreover, citizens of Myanmar also struggling to overcome from injustice. Such a required reaction to preserve their civil rights risks spreading COVID-19 at the moment when coordinated COVID-19 management efforts are affected by political constraints.
First, as a suggestion for COVID-19 management in Myanmar, the nation must wrap it up their vaccination program. This is because with the program, it might lower the risk of being harmful which able to infect or spread the virus actively like the early stage in 2020. The vaccine able to assist the health department in preventing the virus from spreading to another person. There are many critiques over the existence of these vaccines, such as containing harmful contents, haram contents for Muslims, users, and many other inaccurate information fed by inappropriate behavior of people. Next, the suggestion is to increase more employment to serve for the health department. As the COVID-19 pandemic hits Myanmar badly, many people losing their jobs and careers, which resulting them doing nothing during the pandemic. The government able to offer some vacancies for those who lost their job at the hospital, clinics, or army hospital to help as assistant, helpers, PPE sewing jobs, and many more. By providing the opportunity, the people will be happy as long as it will ensure the economy boost during the pandemic, even not same as the normal days previously. Lastly, the suggestion for Myanmar need to have snap election in order to settle down the political conflict. Aung San Suu Kyi detained by her own army because of some wrongdoings. However, it doesn't settle the problem, but more likely being a sentiment for the people to go out and fight the army, as it already considered as coup d'etat. People in Myanmar felt that their rights to voice out opinions are controlled, and they insist themselves as democratically ruined in Burma. This shows the election able to settle down the situation, as well as avoiding the people from doing riots or mass gathering at the country. As a conclusion, for the COVID-19 pandemic management in Myanmar, we are able to witness that the absence of legitimate government affects the health and safety of their people in the country. The country needs to be stable in terms of political situation, as it may affect the people's well-being and welfare. COVID-19 is not a joke or something to be questioned because it already caused numbers of deaths worldwide, not just in a single nation. The people in every country must hand in hand with the government to combat the spread of the virus, as this is a common problem. Not one shall be selfish and manage their own life. In Myanmar, the people need to be more cautious with the surrounding and prevent from doing any chaotic situation just because of the political crisis happen in the country. Any riot or mass gathering need to be avoided and more focus on the vaccination process, and also adhere to any standard operation procedure adherence to the government order. That's all from us. Thank you.